Have you ever felt a strange numbness in your arm and just brushed it off as sleeping in the wrong position? Or maybe a sudden dizzy spell you blamed on skipping lunch? What if those subtle symptoms were your body's early cries for help, a warning that a stroke could be just around the corner? Take Mary, a 62-year-old retired teacher. She noticed her words slurring slightly while chatting with a neighbor and thought it was just fatigue. 2 weeks later, she was rushed to the hospital with a major ischemic stroke, one that could have been prevented if she'd only recognized the signs sooner. Here's the truth: stroke doesn't strike out of nowhere. In many cases, your body begins to signal distress weeks, even a month, before the event happens. That's why in this video, we're diving into the 10 early warning signs that can show up to a month in advance. Signs that, if caught in time, could save your brain and possibly your life. Because here's the problem: strokes are the second leading cause of death globally, and yet most people don't know what to look for until it's too late. And the consequence? Permanent brain damage. Loss of mobility. Loss of speech. Or worse. But there's hope. And a solution. Not only will I show you the signs to watch out for, I'll also walk you through 9 powerful, evidence-backed tips to dramatically reduce your stroke risk. Simple lifestyle tweaks, supplements, and smart habits that doctors wish everyone knew. Don't ignore what your body is whispering to you today, because tomorrow it might be screaming. Before we jump in, if you've ever worried about stroke or found health videos like this helpful, just type 1 in the comments. It helps us know who's already thinking ahead. And if this is your first time watching, type 0. We're glad you're here, and this might be the most important video you'll watch this year. Alright, let's get into it, starting with the warning signs you should never, ever ignore. 1. Significantly elevated blood pressure. Let's start with what I consider the most important, and most underestimated, early warning sign: chronically high blood pressure. What makes it so dangerous? It often starts weeks before a stroke occurs, quietly damaging your blood vessels without any noticeable symptoms. Many people don't even realize it's happening. But make no mistake, this silent force is one of the leading drivers behind both ischemic and hemorrhagic strokes. When blood pressure stays elevated for too long, it places relentless pressure on the walls of your arteries. If you're someone with underlying risks, like fragile blood vessels or conditions that increase bleeding, this pressure can cause a vessel to rupture, triggering a hemorrhagic stroke. On the other hand, in cases where there are fatty plaques or cholesterol buildup, high blood pressure speeds up the damage to the inner lining of the vessels. That accelerates the formation of blockages, increasing your chances of an ischemic stroke, which makes up about 80 to 85% of all cases. Now, here's something I hear all the time from patients as an endocrinologist: "But doc, I feel fine. This pressure is normal for me." Actually, when it drops lower, that's when I start to feel weird. Let me be clear, that's a dangerous myth. Just because you don't feel symptoms doesn't mean your body isn't under attack. High blood pressure is often called the silent killer for a reason. It quietly damages your arteries, your brain, your heart, and your kidneys every single day. You don't have to wait for a stroke or heart attack to find out something's wrong. I'll go deeper into blood pressure numbers and what you can do to bring them down safely in the prevention section. But for now, remember this: if you have uncontrolled high blood pressure, you're living with a ticking time bomb, whether you feel it or not. Stay with me, because we've got 9 more warning signs to go, and then, most importantly, 9 powerful tips that could help you stop a stroke before it ever starts. 2. Atypical headache. Now, let's talk about a symptom that many stroke survivors recall after the fact, but often ignore in the moment: a headache. But not just any headache. What makes this one different is that it's atypical, meaning it doesn't feel like your usual tension headache, migraine, or sinus pressure. It's either sudden and intense, or progressively worsening without a clear trigger. In some cases, the headache can hit like a bolt of lightning, accompanied by blurred vision, partial blindness, or a strange sensation like blood draining from your head. This can be a sign that a major blood vessel in your brain has been compromised, either by a blockage or bleeding. Here's something critical: if you experience a headache that's new, unusually severe, or just feels off, don't dismiss it. Especially if you're someone who doesn't normally get headaches, or if this one feels very different. In some situations, this kind of headache may actually be a warning sign of what's commonly called a mini-stroke. That's not a medical term, but it helps get the point across. The real name is a transient ischemic attack, or TIA. So what is a TIA? It's a temporary interruption of blood flow to the brain. The symptoms may last only a few minutes, maybe an hour, but they go away on their own as the body restores circulation. And because they pass, many people brush them off. But here's the sobering reality. 1 in 5 people who experience a TIA will go on to suffer a full-blown stroke within the next 30 days. That's why a strange headache should never be ignored, especially if it comes with vision changes, dizziness, or confusion. It's your brain waving a red flag. Getting tested promptly, MRI, CT, or blood flow scans, can catch the warning signs early, giving you a crucial window to act and avoid permanent damage. 3. Numbness on one side of the body. This symptom can come on suddenly and feel strange, like your arm or leg is heavier than usual, or maybe it's gone a little numb or tingly, almost like it fell asleep. You might notice you can't grip things as easily, or your leg isn't quite cooperating when you walk. Here's why this is so important. When blood flow is interrupted in a specific part of your brain, whether by a clot or a brief blockage, it often affects the opposite side of the body. That's how the brain is wired. So if there's a problem in the left side of your brain, your right arm or leg may go weak or numb. And if the issue is on the right, it could impact the left side of your body. It doesn't always affect the entire side. Sometimes it's just one arm, or just a leg. But regardless of where it shows up, even if it's mild or only lasts a few minutes, this is your body waving a huge red flag. People often hope these symptoms will pass, and sometimes, they do. But that doesn't mean you're in the clear. In fact, symptoms that resolve quickly may actually be a transient ischemic attack, TIA, or mini-stroke, which is often a precursor to a full-blown stroke. So please, don't wait, don't hope, and don't book an appointment for next week. Go straight to the ER. This is an emergency that needs attention now, not later. I can't stress this enough: time lost is brain lost. 4. Difficulty speaking or understanding. Imagine talking to someone and suddenly, your words just won't come out right. Or maybe they come out, but they sound jumbled or don't make any sense. You know what you want to say, but it's like your brain and mouth aren't working together. On the flip side, maybe someone's speaking to you and you hear the words, but they don't make any sense, like they're in a foreign language. This kind of language disturbance happens when the area of the brain responsible for processing speech and comprehension, often on the left side, is affected by a lack of blood flow. We call this condition aphasia. It's a medical term that simply means you can't speak clearly, or you can't understand language the way you normally would. It doesn't always present the same way. For some, it's a total inability to form words. For others, the words come out, but they're out of order or irrelevant. And sometimes, it's the listener who notices something's wrong. Maybe the person you're talking to starts giving you unrelated answers, or seems confused when you speak. No matter how it shows up, this is a major red flag. If you ever notice this in yourself or someone else, don't explain it away as tiredness, stress, or brain fog. Aphasia is often one of the brain's first SOS signals that something is seriously wrong. It could be a stroke in progress. Or it could be a transient ischemic attack, the kind that gives you a narrow window to act before something more permanent sets in. 5. Balance disorder. The fifth warning sign is one I've seen time and time again, and sadly, it's often brushed off or misinterpreted: sudden problems with balance or coordination. This usually happens when blood flow is reduced or blocked in the part of the brain that controls movement and equilibrium. As a result, the person might suddenly have trouble walking straight, staying upright, or even just standing still. I can't tell you how many times I've heard someone rush into the ER and say, "He looks drunk. He's stumbling like he had too much to drink, but I know for sure he hasn't had a sip." And they're right. What they're seeing isn't intoxication, it's a neurological red flag. The person's gait is altered, meaning the way they walk or move has changed. They might be swaying, dragging one foot, or unable to keep their balance. Even if it comes on suddenly and seems like it might pass, this is not something to wait on. It could be a sign that a part of the brain, possibly the cerebellum or brainstem, is being starved of oxygen. And if that's happening, a stroke could be underway. Please, if you or someone around you seems off, unsteady, or is walking strangely without any clear cause, don't assume they're tired or dehydrated. Get help immediately. Top of Form 6, excessive fatigue. The sixth warning sign, and one that often catches people off guard, is unusual, overwhelming fatigue. We all feel tired from time to time. But this kind of fatigue is different. It's not just the result of a long day or a poor night's sleep. It's the kind that feels deeper, heavier, and more persistent than normal, and it can show up days or even weeks before a stroke occurs. When I talk to stroke survivors, this is one of the most common things they recall: "I just felt completely wiped out. I didn't think much of it at the time, but looking back, it wasn't normal." Now, of course, fatigue has many possible causes: stress, anemia, thyroid problems, even dehydration. But when it comes on suddenly or lingers without a clear explanation, we have to consider something more serious. Could it be a sign that the brain isn't getting enough oxygen? A blockage in a blood vessel, even a partial one, can subtly disrupt circulation, leaving the brain working harder just to function. The result? Your whole body starts to feel drained. That's why it's so important not to brush off extreme tiredness, especially if it's new, persistent, or paired with any of the other signs we've already talked about, like numbness, imbalance, or trouble speaking. It may not always mean a stroke is coming, but if it is, early detection can make all the difference. We're almost there, just 2 more warning signs to go. 7. Change in motor coordination. This isn't always the dramatic kind of symptom we tend to associate with strokes, like full paralysis or the sudden collapse of a limb. Often, it's something much quieter, but just as important. Many people who later suffered a stroke described moments where they suddenly had trouble with basic tasks, things they used to do effortlessly. Maybe you're trying to type on your computer and your fingers aren't responding the way they usually do. Or you're washing dishes and realize one hand feels weaker or clumsier than the other. It's not painful, but it's different. Something just feels off. This happens when blood flow is disrupted in the part of the brain that controls fine motor skills. As a result, your ability to coordinate movements becomes slightly impaired, maybe not enough to alarm you right away, but enough to slow you down or make everyday tasks more difficult. One hand might suddenly struggle to grip objects. One foot might feel slower or less steady when walking. You might notice a mismatch between the strength or control on your left side versus your right. And while it might seem minor at first, any unexplained change in how your body moves deserves attention. It's your brain trying to keep things going despite a loss of oxygen and nutrients, and that compensation has a limit. So if you or someone you know experiences this kind of sudden clumsiness, weakness, or awkwardness in movement, especially on just one side of the body, don't write it off as nothing. It could be the earliest sign of a much bigger problem. 8. Visual changes. The eighth and final early warning sign is one many people tend to ignore: sudden changes in vision. This can show up in a few different ways. Maybe your vision becomes blurred, like you're looking through a foggy window. Or you might suddenly see double, even when only using one eye. Some people experience partial vision loss, like a shadow covering part of their visual field, or a sudden inability to see from one eye at all. No matter how it appears, here's what you need to know: any sudden change in vision is a medical emergency. I know, it's tempting to think it's just eye strain, fatigue, or maybe something wrong with your glasses. And yes, vision changes can have a range of causes. But when it comes on suddenly, especially if it's paired with other stroke-like symptoms, it could mean that blood flow to the visual processing centers in your brain is being disrupted. And that's a red flag. Your eyes may be working perfectly, but if your brain can't process what they're seeing, the problem isn't optical, it's neurological. And if left untreated, the damage can be serious and even permanent. So please, don't wait to see if it improves on its own. If you or someone you're with experiences sudden blurry vision, double vision, blind spots, or complete loss of sight in one eye, don't hesitate. Get emergency medical care immediately. We've now covered all 8 warning signs that can show up days or even weeks before a stroke strikes, and knowing them could save your life, or the life of someone you love. But knowledge is just the beginning. Next, I'm going to walk you through 9 powerful, practical steps you can take starting today to dramatically lower your risk of stroke, and protect your brain and body for the long run. 1. Reduce salt and sodium intake. Let's begin with one of the simplest, but most powerful, ways to protect yourself from stroke: cutting down on salt. It might not seem like a big deal, but studies have shown that reducing sodium intake can lower your risk of stroke by up to 40%. That's a massive impact from a single lifestyle change. Here's the issue: in many countries, the average person consumes 10 to 11 grams of salt per day, more than double the recommended amount. According to the World Health Organization, the ideal intake is no more than 5 grams of salt daily, which equals about 2 grams of sodium. Now, this doesn't mean you need to eliminate all salt from your life. But it does mean you need to be mindful, especially when it comes to processed and packaged foods. Salt hides in places you might not expect: breads, sauces, canned soups, deli meats, even so-called healthy snacks. So start checking labels. Look at the sodium content per serving. Cook more meals at home when you can. And whenever possible, season your food with herbs, lemon, or spices instead of reaching for the salt shaker. Think of every gram you reduce as a gift to your blood vessels, giving them a better chance to stay strong, flexible, and open. It's a small shift that can lead to massive protection down the line. Ready for the next one? Let's talk about the second powerful tip. 2. Control your blood sugar. Next up is something absolutely essential, especially if you're living with diabetes or prediabetes: keeping your blood sugar under control. High blood sugar doesn't just affect your energy or weight, it slowly damages the inner lining of your blood vessels. Over time, this damage makes it easier for cholesterol and fat to stick to the vessel walls, leading to atherosclerosis, or hardening and narrowing of the arteries. And once those arteries start to narrow, blood flow to the brain becomes more restricted, which dramatically increases the risk of stroke. People with diabetes are at much higher risk of having a stroke, not just because of blood sugar itself, but because of the compounded effect of inflammation, vessel damage, and plaque buildup. So if you have diabetes, or even if you're borderline, don't wait for symptoms to appear. Work closely with your doctor. Monitor your blood sugar levels regularly. Focus on a balanced diet, rich in fiber and low in refined carbs. Stay active. And take any prescribed medications seriously. Remember, stable blood sugar equals stable blood vessels. And that means a stronger heart, a sharper brain, and a lower stroke risk. 3. Don't smoke at all. You probably saw this one coming, but it's worth repeating loud and clear: don't smoke. Whether it's cigarettes, e-cigarettes, roll-ups, or cigars, they all significantly increase your risk of stroke and other cardiovascular diseases. Smoking damages your blood vessels in multiple ways. It causes inflammation, raises your blood pressure, makes your blood more likely to clot, and speeds up plaque buildup in your arteries. That's a dangerous combination when it comes to brain health. And no, switching to e-cigs or light options doesn't eliminate the risk. The chemicals involved still harm your cardiovascular system. If you smoke, I know quitting isn't easy. But I promise you, it's one of the most impactful decisions you can make for your long-term health. Within weeks of quitting, your circulation improves. Within months, your stroke risk begins to drop. So don't wait for a health scare to make the change. Your brain, and your entire body, will thank you. 4. Manage your cholesterol wisely. Here's something important to remember: your body needs cholesterol to survive, but too much of the wrong kind can quietly put you on the path to a stroke. When we talk about excess cholesterol, we're mainly talking about LDL, often called the bad cholesterol. This is the type that builds up inside your arteries, forming plaques that narrow the vessels and restrict blood flow to your brain. But here's the thing: not everyone needs the same cholesterol target. If you're generally healthy and low risk, an LDL around 130 mg per deciliter might be acceptable. But if you have other risk factors, like diabetes, high blood pressure, or if you smoke, we aim for lower numbers, ideally under 70. And if you've already had a heart attack or a stroke, then we get even more aggressive. In those cases, the goal is often below 55 mg per deciliter to truly minimize further risk. And cholesterol isn't just about LDL. You also want to keep your HDL, the good cholesterol, above 40, as it helps clear excess cholesterol from your bloodstream. And don't forget about triglycerides, another important fat in your blood. Try to keep those below 150 mg per deciliter. This isn't about perfection. It's about knowing your numbers and working with your doctor to reach safe, personalized targets. Whether through lifestyle changes, medication, or both, managing your cholesterol is one of the smartest moves you can make for your brain and heart. 5. Regular physical activity. One of the best things you can do to protect yourself from a stroke, really, to protect your overall health, is to stay physically active on a regular basis. You don't need to become a gym rat or run marathons. In fact, research shows that just 150 minutes of moderate exercise per week can make a significant difference when it comes to heart health and reducing stroke risk. That might sound like a lot at first, but it's actually quite manageable. You can break it up in a way that fits your lifestyle: 30 minutes a day, 5 days a week, or maybe 50 minutes 3 times a week. Even shorter sessions throughout the day add up. What's most important is that you find an activity you enjoy. That could be a brisk walk around your neighborhood, cycling, dancing, swimming, or even working in the garden. When you enjoy the movement, it's no longer a chore, it becomes part of your life. Physical activity helps regulate blood pressure, improve cholesterol, manage blood sugar, and maintain a healthy weight. All of these factors directly impact your risk of stroke. So the goal isn't perfection. It's consistency. Move your body regularly. Keep your blood flowing. And give your brain the oxygen and nutrients it needs to thrive. 6. Weight control. Now, this isn't just about appearance, it's about what's happening inside your body. Fat tissue isn't just extra storage, it's biologically active. It produces inflammatory substances that can affect your blood vessels, your metabolism, and your heart. When inflammation increases, so does your risk for conditions like high blood pressure, insulin resistance, and, you guessed it, stroke. The good news is, even modest weight loss can make a big difference. Shedding just a few pounds can help reduce this internal inflammation, improve how your blood vessels function, and take pressure off your heart and brain. You don't have to aim for perfection. Focus on gradual, sustainable changes, like eating more whole foods, moving your body regularly, and being mindful of portion sizes. It's not about chasing a number on the scale, it's about creating an environment in your body that supports healing, balance, and long-term health. 7. Get quality sleep. Let's take a moment to talk about something that often goes undiagnosed, but can seriously impact your stroke risk: obstructive sleep apnea. This is a condition where your breathing repeatedly stops and starts during sleep, causing your oxygen levels to drop, sometimes without you even realizing it. When that happens, your brain and other organs experience periods of low oxygen, known as hypoxemia. Over time, this oxygen deprivation puts tremendous strain on your body. It contributes to high blood pressure, worsens blood sugar control, and increases inflammation, all of which are major risk factors for stroke. So how do you know if you might have it? If you snore heavily, wake up gasping for air, or often feel exhausted even after a full night's sleep, those are red flags. Sometimes a partner may notice you stop breathing for short periods during the night. If any of this sounds familiar, get tested. A sleep study can provide answers. The best part? Treating sleep apnea doesn't just improve your sleep, it can lead to better blood pressure, improved glucose control, and a significantly lower stroke risk. So if you've been ignoring your sleep problems, now's the time to take them seriously. Your brain and your heart will thank you. 8. Manage your blood pressure. Another powerful step you can take is to monitor your blood pressure regularly at home. High blood pressure is one of the most significant risk factors for stroke, but it can also be tricky. Sometimes, your readings at the doctor's office are elevated due to stress or anxiety. This is known as white coat hypertension, and it can sometimes lead to unnecessary treatment. But the reverse can also happen. Your blood pressure might look fine in the clinic, but be consistently high at home or during daily activities. That's called masked hypertension, and it's especially dangerous because it often goes unnoticed. That's why home monitoring is so important. Keeping track of your readings helps you get a clearer, more accurate picture of your blood pressure trends over time, not just at one appointment. In general, we aim for a target of 120/80 mmHg. When readings are consistently 140/90 or higher, that's considered a serious risk, and it may warrant lifestyle changes or medication, depending on your overall health profile. So invest in a reliable home monitor, take your readings regularly, morning and evening is ideal, and log your results. Share them with your healthcare provider so you can make decisions based on real-world data, not just a single visit. It's a simple habit that can help prevent one of the most devastating health events imaginable. Next up is the final tip, one that ties together everything we've discussed, especially in today's high-stress world. 9. Check for arrhythmias. Many people don't realize this, but a significant number of strokes are caused by irregular heart rhythms, especially a common condition called atrial fibrillation, or AFib. When your heart doesn't beat in a steady, coordinated way, it can cause blood to pool and form clots, and if one of those clots travels to your brain, it can trigger a stroke. The good news? AFib is often easy to detect. A simple electrocardiogram, ECG, performed during a routine checkup can pick up signs of it. If your symptoms come and go, or only happen occasionally, your doctor may recommend a 24-hour Holter monitor or a longer-term rhythm monitor to track your heart activity over time. If you've ever felt your heart racing, skipping beats, fluttering, or pounding, especially if it happens at rest, don't ignore it. These may be signs of arrhythmia, and getting checked could quite literally save your life. With proper treatment, whether through medication, lifestyle changes, or medical procedures, the risk of stroke from AFib can be significantly reduced. So take that step. Listen to your heartbeat, both figuratively and literally. Your heart and your brain are deeply connected, and caring for one helps protect the other. With that, we've reached the end of our 9 powerful, science-backed tips to prevent stroke, but remember, the true power lies in taking action. Even small changes, done consistently, can dramatically shift your health trajectory. And by recognizing the 8 early warning signs we covered earlier, you're already ahead of the curve. If this video helped you, share it with someone you care about. You never know whose life you might save just by passing along the knowledge. Stay safe, stay informed, and take good care of your body. It's the only one you've got.